So lovely to have you with us today and also collaborating on the conference in Gabon. I guess my first question would be, how do you feel about 2026 as a moment in time in relation to Iboga and your personal relationship with it, but also kind of what's going on in the field and the discourse?
How many hours do I have to answer that question?
As many as you like, and then we'll cut it.
I'll try to make it brief. No, 2026 is so far, I mean, we're still in one of 12 months. Pretty amazing. Was just in Gabon supporting both Americans for Ibogaine and Reset Health. And I thought it was pretty historical. I thought there was a lot of open dialogue. I mean, not without its drama and the usual human part of everything, but both 2026 from a macroeconomic perspective and 2026 from the fact that, you know, up until a few years ago, people didn't know about Iboga or Ibogaine really. And there was just the first like international conference hosted in Libreville. And I thought that was pretty compelling. And I thought that was, you know, off to a great start for 2026.
That's really exciting. And do you feel like it's putting the Bwiti community kind of more central within discourses that were maybe more Ibogaine centric before these kinds of moments began to happen?
There was definitely an emphasis on both. You know, again, within the context of it, or even the context of what's happened in the last couple of decades, but more so the last few years, Ibogaine is certainly on the map, right? If you look at all the various indications, and again, the narrative right now around Ibogaine is mostly use disorders and traumatic brain injury and PTSD. Granted, it can be utilized for potentially an infinite amount of indications, but that's where the science and the research is important. And I think what was really special about Gabon last week, and that there was this conference, was where do the two align and who's supposed to benefit from it? Whether you pull the Nagoya protocol and there's other frameworks, or you say, wait a minute, from a clinical perspective, Indigenous wisdom happens to know a great amount about this medicine, right? And if there is a pharmaceutical company or a drug company or someone developing Ibogaine, wouldn't it make a lot of sense to engage them, regardless of your belief in reciprocity or the current state of the world? I mean, simply in the myopism of like de-risking clinical trials. So that kind of came up. And you saw this nice dance, this nice, at least on the surface, ability to say, hey, we're all at the table. And maybe there's a place for both. And why would we ever ignore Indigenous wisdom as it relates to the physiology, the basic risk mitigation? I know that sounds weird to say risk mitigation and Bwiti in the same sentence, but this is just my current perspective, which is somewhat fresh coming out of Libreville just today, Wednesday? I think it was Monday. You know, it's just only 48 hours fresh for me. So I hope I articulated to some extent the answer to your question of Bwiti and Ibogaine and Iboga, and not just Bwiti, but Pygmies, as well as some of the cultures in Congo and Cameroon and Guinea-Bissau, Fang and Nigeria. I mean, it's expansive, but no doubt Gabon, it deserves so much credit. And the fact that you guys are, you know, putting something together, which is like TikTok, June's going to be like tomorrow all of a sudden, even though we're in January. So great question. And not sure if I answered it appropriately, but that's my answer.
I loved the synthesis of so many of these different pathways. And I think that is one of the things that's so exciting about the dialogues around this conference is the different things coming together. But a place that I'd like to jump into is your portfolio is very much around psychiatric therapies, neurological research, and also kind of biomedical research. So you're coming from this really wonderful technical scientific approach to the medicine. And so I'm wondering about your personal journey within that and where science and spirituality sit with you and whether they're maybe actually the same thing or how you calibrate them in relation to your research and then the ancientness of the tradition of Bwiti.
How many months do I have to answer that question?
Again, as many as you like, and this could just be within many wider conversations.
Yeah, I mean, it's funny. I was in a really fun discussion this morning in the UAE right now, but I was meeting with some Central African diplomats. And yeah, there was some sentence kind of akin to, how do you quantify the ineffable? How do you measure the universe? And I don't know. So like, the moment you introduce, all the wonder, all the awe that comes from everything that's Bwiti, that's pygmy, that's indigenous in a medical context, it seems like it's a bit of an oxymoron. But that's what I've been trying to. And to answer your question on your journey, I was exposed to plant medicine pretty early in life, and just it's been a fun few decades. I also have always liked business and entrepreneurship, and I think it's one of the most courageous things you can do to be an entrepreneur, and then take a risk and put it all on the line. And it's really quite courageous. So trying to merge the two or figure out a way where they can all play nice together. And also, again, that's personal from like a portfolio construct perspective, or what do we invest in? What's the focus? Like, how can you say, neuropsychiatric disorder in the same sentence of an ephemeral experience where you taste the void? But it's exactly at this point in time where a conference of import, which you'll be hosting, I think is exactly the type of question that we're getting closer to cracking the code of what that could be. Again, maybe that's wishful thinking and completely ignorant, and just, I'm filled with hope right now. But yeah, I do think there is a way with, all the gobbledygook of medicalization and all the wonder of all things plant medicine, to find a happy medium and for them to support each other. And that was kind of why so many people came around the table, and why you're seeing this kind of this uprising, this wellspring of people talking about these two things, which used to never be discussed in the same room. You'd never go to a neuropsychiatric conference and talk about psychedelics or Bwiti or indigenous wisdom. And in the same vein, you would never be deep in a jungle and talk about, a phase 2A trial. But these conversations are starting to happen. Again, I'm not sure if I answered the question or just asked 10 other questions, but
Well, both, but I love the way you languaged it. And I love this idea of kind of birthing things in the void, and that kind of cross-pollination between the ethereal realms and then the turning of things into medicines. So something I'm wondering about is with the JLS Fund, firstly, it would be great to get a beginner's introduction to what that is for anyone who doesn't know. And also the ethos of seed funding, the things that you fund, and what excites you about that. Like, what do you look for in the world, and where does that come from within your awareness of the more imaginal realms? Like, how does that cross-pollinate into the things you choose to fund and the changes you're trying to make in the world with that funding?
my first answer is myself, my partners, everybody I work with on the greater JLS team. Many were operators. Many went through this entrepreneurial journey. So that's really in the heart of it. It's not exactly an investment thesis or a mandate, but we're all still human. And if I've had 2 successful exits, but a dozen really successful failures, to be able to work with entrepreneurs and early stage companies as they navigate, all the landmines leading to success or the exit or the impact that their company can provide to the world, is, I think, one of the bigger reasons we're all together, and why it's just been really fun. On the other hand, I could say, we're a brain health fund. On the other hand, I can say, we focus on investing in the next leaders that focus on mental health and neurodegenerative diseases. So all of those answers kind of are the same to why we exist, why JLS was even funded, is because a bunch of really thoughtful people who also really liked business and entrepreneurship, policy and advocacy and regulatory law, saw this window of opportunity about 7 years ago. And I remember the call specifically. It was one of my co-founding partners. And it was something akin to, hey, I think there might be a new alternative asset with asymmetric upside. Like, what? An alternative asset with asymmetric upside? What are you talking about? Blockchain AI? And I'm like, no, I'm talking about, neuroplastogens, psychedelics, plant medicine. So in that 7 years of our journey from that first investment, I think we've proven out, definitely from the more standard perspective of, we've returned capital, sometimes in excess of, really, really good amounts, and where you're not looking at that as your sole metric, which is usually the private equity, the VC. Hey, I'm going to give you $1. Hopefully, in a few years, you're going to give me back $10 or $100 or whatever. But then there's a societal impact. And what impact did you make to lives and souls and healing? So we cross kind of both of those. So JLS Fund, again, is an early stage capital fund focused on C to, like, let's say Series A. We really have enjoyed being early checks and even working with companies for months in the trenches where we may not invest or we're not the right fit, but it's still such a joy and provides more return for us than simply the capital. And we happen to do really great at returning investors' capital. So, very simple, early stage VC fund that invests in any company that has a modality, a technology, a drug that can help cure, alleviate all the pain and suffering that, more or less is the human condition.
It's a really, really beautiful project and a beautiful answer. Thank you. Something I'm curious about is you clearly must have had to be in many different kinds of rooms convincing various people of different properties of psychedelics and Iboga over the years in order to put this together and get to this position. Do you feel like the types of things you need to convince people of have changed as there's been a kind of boom in awareness about ibogaine and Iboga? Are you having different conversations about validities and other things you feel the need to try to prove in conversation, or evidence in conversation evolving in step with that?
Yeah, fortunately, this was a little harder 30 years ago, let alone 7 years ago when there became like kind of market opportunity. But now you just show data and they go, what? Those results? Huh? Why isn't traditional medicine looking at this? Why isn't healthcare reimbursing this? So at least right now, it's very easy to be in a conversation because I can show data from a trial. And that has more weight because it's the possibility of that can be shared with the world than the anecdotal data of 30 years ago. But now that we have universities and clinical trials and investable companies proving this out, mostly through clinical trials, there's state models, there's other jurisdictions, but it's really the data. You can't dispute the data, whether it's in animals and then proven in humans, and then actually talking to patients. And it's like, wow, you were near suicidal. Now you're not. And that's enough to convince, to begin a dialogue with even the most, die-hard stigmatists who, were, let's say, disciples of Nancy Reagan and the war on drugs and all of that. It's like you show a patient, you show the data, and it's like you don't have to convince anybody. And that's becoming more and more and more common, which is why money, government, institutions, NGOs, and even the zeitgeist of what's happening right now is turning more positive out of the negativity of a lot of misinformation over the decades.
I'm really happy that you brought up Nancy Reagan and Just Say No, because something that I'm really curious about within this is I didn't see that much from my research on the kinds of projects you fund specifically about addiction as such, but of course that's such a big part of the ibogaine and Iboga discourse. So I'm wondering how your conceptualization of addiction has changed over the years and how that's kind of interpolated with experiences with Iboga and with Bwiti and with the culture in general.
I feel a little stumped on that question. That's a really hard question.
I'm really sorry. It's something I. It's something
No,
I
it's
a lot
good, but it's
personally as
making
well.
me think because it's like even without plant medicine, what is addiction? There's like the Gabor camp, it's all trauma. There's when you get into the more the past life stuff, environmental factors. It's such a complex answer to a profoundly simple question of what is addiction. And hey, maybe we make this a series, and I think on that, and like in a month, I come back with the most perfect answer because right now I'm a little stumped on answering, like what I've seen, but I've definitely seen people who have been able to get their, the proverbial monkey off their back, having tried everything from methadone, Suboxone. My favorite, and this kind of gets into the other work we do, which isn't in our website, which isn't in our portfolio, but this is about a year and a half ago. I spent the day at Angola, not the country, but the largest prison. And the warden there was like, if he doesn't win a Nobel, I'll be shocked. But he brought us into, after death row, he showed us kind of this impromptu detox he set up. And there were 160 prisoners in there. And their protocol was faith and cold turkey. So it's like abstinence in Jesus or whatever your faith was. And it was so compelling, and it was so like, here's this system we built, very much in the criminal justice reform space. And we know how drugs get in. We know that there's addiction problems, but I'm going to do my best within the confines to solve it. Yeah, I've seen some like miracles around addiction. I've also seen great failures, not so much on the medicine, but what happens after the fact or even on the preparation, the inability for equitable access, the inability for insurance to cover it, the inability to go back to a state of being where you're not triggered in the same way, you're going back to the same toxic environment. Those are as important as the neurochemical or the spiritual, whatever label you want to use for it. So that's some of the work we do that's not like necessarily public, but it drives us and it's important. And it does provide great signals. The reason I've been in like, a half a dozen countries in the last 6 weeks, they've all been high level policy regulatory stuff, but you wouldn't see that from, oh, this guy's just got a fund, but those signals, talking to those leaders gives us a nice blueprint of how a drug might get approved or a new modality might be accepted in a narrative perspective.
Can I ask you a bit about pharmacology? It does seem
Mhm.
to make a lot of sense to me that it's easier to argue for ibogaine on its own to be approved in various contexts than to try to argue for the whole plant, which I guess is why the US has gone with the kind of sacramental route and the setting up of all of these churches so that it can be done in these ritualistic settings. But what is the future in your mind for whole plant iboga and science to kind of work together?
It's already happening. It's like, it's funny. It's like so many people think it's either black or white, but it never is black or white. So it could be this full medicalization, or it could be the whole church model. It could be a state or another jurisdiction, but it's never one. It's all of them. It's just, when do they peak? When are those inflection points? So, as I step back, I see, the magic of, whether you're talking about ibogaine or plant medicine or next gen therapeutics. I mean, it's kind of happening in a lot of different corners, and there won't just be one way. And more people are starting to talk, oh, you do it that way? Oh, I never thought about doing it that way. I mean, to sit with a neuroscientist and a shaman, like, that rarely happens. And that seems to be happening again and again and more and more. And that's, I think, evidenced in like even this discussion and even the conference I just came from and the conference you guys are hosting in June. So it's not going to be one or the other. It's going to be all of them. It's just which cadence and which ones will serve the patient or the human better, and over what period of time and over what series of obstacles, which usually are advocacy, regulatory movements, money, laws, etc.
That sounds like a lot more cross-pollination is going on than is necessarily being represented in the media discourse on all of this right now. What are some of the main trends in the kind of public-facing discourse and the reportage about Iboga and Ibogaine that you would like to see kind of revised or nuanced? And are there any buzzwords that we should be replacing or abandoning?
Well, the one point I touched upon, and it's been one I've been playing with for quite a long time, indigenous wisdom and reciprocity, but not as like a moral tax, not as a neo-colonialist, but as a, wait a minute, there's so much intelligence in that. And if you're a drug company and you're going to be putting billions into getting something approved, wouldn't you want to like de-risk? And it's like, hey, even if you're developing something based on Iboga and it's the Iboga scaffold, like it's kind of going to be a lot of the same physiologies. And there's thousands of little tricks isn't the right words, but protocols utilizing, the wood that have been developed for so many years, millennia, one might say. So why not utilize that? So I think that might be something, or maybe I'm just hopeful or too hopeful that there could be some bridge where the indigenous benefits from their knowledge, but not as a moral surcharge after the fact, but at the beginning. So that might become a trend I haven't seen. I've definitely been sharing with a few folks. What do you think about this? And they're like, oh, that's novel. I don't know if anyone will buy it, if it'll work. But at least that's something I've been playing with because I get to play on both sides in the sense where, I get to hang out and understand the depth and the wonder of the technology of the indigenous, but also get to be in like boardrooms and see how a drug gets developed and how much money goes into developing a drug. So that's something, it's not a label yet. I don't have the name for a label, but I think it's a new thing. Maybe I just haven't heard anybody else articulate it quite that way.
It's a really important and beautifully liminal and very dexterous thing that you're describing there and articulating. And I think the sense of this kind of cross-pollination between these different realms and this sense that there needs to be a bridge with more specific steps so that more people can walk back and forth across it is it's a really beautiful metaphor. Wondering how Bwiti being an oral tradition and the sense of like some things that feel shareable versus some things that feel less shareable sits with the bringing of Bwiti into some of the other spaces where you tread.
That's a hard answer. I mean, just because of how I navigate in my life, where I'm just like not very secretive, try to bring people together. So it's like usually I don't come into a space where there's contention or mistrust or distrust. Or if I do, people aren't telling me, at all. That being said, there's something about the sacred, right? And that should never be taken advantage of. So there is still a ton that even in my years and what I've witnessed, I'm sure I've only scratched the surface and gotten a hundredth of a millionth of 1% of what's really there on the sacred side of things. But as you get deeper, and regardless of whether it's Iboga or another plant medicine, into the technologies that have been developed for so long, and the openness of the fact that we're all one species, at least for a while. I give us another 10 years, right, before we're just the AI overlords take over everything. I'm kind of joking there. But at least right now, we can agree we're all human and we all kind of operate under the same cause and conditions, right? We're born, we suffer, we die. That's pretty universal. So within that context, I'm seeing an openness from traditions, and everything is that the world is getting smaller very quickly. And the fact that there's very few places where and again, this is technology and just the speed of everything where we're not super connected. I didn't on this last trip deep in the jungle see anyone, posting to TikTok or a Starbucks on every corner of the river. But it's like we're becoming this very consolidated species, even though we also see this huge divide of wealth and poverty. So hopefully, with all that, there's a light at the end of the tunnel and everybody can kind of work together and everything Bwiti and everything medicalization could find harmony because the end goal is for this species that we might be on the last epoch of it anyway. So why not to get dystopian, but why not prosper and flourish and kind of be kind and have fun while doing it?
That was absolutely beautiful. Thank you for that answer. Something I was wondering throughout it, and you touched on this with the connectivity of everyone, and I was thinking it's beautiful and double-edged that we're able to have this conversation, and I'm in Britain and you're in Dubai on a boat, and we're able to talk about this stuff. But Ryan, I remember saying something interesting about like recent retreats. There's been a kind of trend of multiple people feeling like they're being told to put down their phones, or that like the spirit of Iboga is kind of warning against being absorbed by technologies. So I'm wondering more about kind of AI and its benefits and risks in relation to positive ways that we could be growing and ways we want the world to change in relation particularly to the conference and the good that Iboga and Ibogaine have the potential to do and are doing. Like, how does AI and technology and maybe even technology dependency kind of intersect with that in your mind?
Yeah, that's a real slippery slope. I don't know. I wish I did. I mean, the experience, whether you're at a clinic doing Ibogaine, just quite transformative, or deep in the jungle. And this could be true of a lot of plant medicines, but it still comes back to the individual and the container. And, if, these are non-specific amplifiers, it's really important to get that. What are you amplifying? But I've certainly come across groups and people. I think there's aeons of traditions. I mean, Charles Manson comes to mind at the second. Like, that didn't work out too well, and yet he was doing these really strong molecules that many people will say, like, hey, this is great. So I don't know how tech is going to weave its way. I don't know if it's going to be better or worse. Those who are doing it in a genuine way with authenticity, who's had their own transformation, I think will, shepherd, hold the torch, lead the charge, whatever the right metaphor is. Hopefully they will, but it's really uncertain. I mean, again, maybe all the way back to the beginning, 2026 is pretty darn uncertain. Yeah, even picking up my phone this morning, I was like, you told me I was reading the news I read this morning a year ago, I wouldn't believe it. So who knows what next month will even unfold. So I think I've failed completely in trying to answer that question, but I don't have an answer. Equally, like, I don't know how it's necessarily gonna play out, but I hope for the good and I hope for the positive, and I hope along the way we have some fun and help some people who are suffering.
Definitely. I think as a kind of, this has been so rich and beautiful as a set of answers. And I think I've definitely got a lot of things I'd like to ask you, like future follow-up questions on. But for now, I think as a wrapping up question, can we go a bit personal, and can you tell me about how your personal approach to life has changed as you've engaged more with Ibogaine and Iboga?
Yeah. I mean, definitely more reverent, definitely more like it's both reverence. That's definitely been a thing, for those who experience anything that is, quote unquote, a psychedelic in the right container. And that could be a clinic, that could be a church, that could be a forest. It's near impossible not to have at least a small opening of reverence and grace. So that's definitely been a shift. For me too, again, this is totally personal. And this, somewhat defies the medicalization or even the rite of passage or even the deep transformation. I could say this now. It was a little harder to say back in the day, but like, people don't play enough, and these are really fun too. So having fun. So my experience in whatever the tradition is or whatever the plant medicine is, and again, fully personal, is that there's a joy and a playfulness and a fun to the actual lived experience of it and the afterglow and the afterflow and how you integrate that. Or at least it has been for me.
I think that's a really incredibly important ingredient, and it can be all too easily forgotten in the seriousness of some of the medicalization political discourse. But it's that's a really, really beautiful note to end on. Thank you so much for this conversation.
It was a great pleasure, and I hope to meet you in real life very soon, and anything else you need. And but yeah, this was a great half hour. Now I'm gonna go dance.
Enjoy. Have a beautiful, beautiful rest of your night. Lovely to meet you.
Excellent.